If you've been diagnosed with thoracic outlet syndrome or have shoulder, arm, or hand discomfort, you're going to want to watch this video. Let's get right into it. Thoracic outlet syndrome: treatment, symptoms, causes, and diagnosis. The thoracic outlet is the ring formed by the top of the ribs, just below the collarbone. And the thoracic outlet syndrome occurs when nerves or blood vessels are compressed by the rib, the collarbone, or neck muscles at the top of the outlet. There are three types of thoracic outlet syndrome. First type is neurogenic thoracic outlet syndrome, and this occurs when nerves leading from the neck to the arm, the brachial plexus, is compressed. And more than 90% of thoracic outlet syndrome cases are neurogenic. Then the second type is venous thoracic outlet syndrome, and this occurs when a vein is compressed, leading to upper body thrombosis. And this occurs in about 5% of cases. And then last, third type is arterial thoracic outlet syndrome, and that's when an artery is compressed, and this accounts for about 1% of cases. So let's discuss the symptoms of thoracic outlet syndrome. The symptoms of thoracic outlet syndrome really depend on the type of thoracic outlet syndrome that I just went over, but let's go into symptoms of neurogenic thoracic outlet syndrome. So with neurogenic thoracic outlet syndrome, you're likely to have pain or weakness in the shoulder or arm, tingling or discomfort in the fingers, and an arm that tires quickly. Now, this can sometimes be confused with spinal stenosis in the neck, because that can also cause an arm to tire quickly. But also atrophy or weakness in the pad of the thumb, the muscle of the palm that leads to the thumb. This is quite rare though. And symptoms may come and go, but they are often made worse when arms are held up above your head. The longer the arms stay up, the worse the symptoms can get. And this is a good sign that you do have thoracic outlet syndrome. Symptoms of venous thoracic outlet syndrome would be edema, swelling of the arm, hand, or fingers, blueness of the hand, and even blueness in the arm area, forearm or upper arm, painful tingling in the hand and your arms as well, very prominent veins in the shoulder, the neck, and the hand. And these symptoms occur because compression of the vein may cause blood clots. This is known as effort thrombosis or Paget-Schroeder syndrome. Effort thrombosis is a type of deep vein thrombosis. In this case, the clots are formed as the result of overhead motions or efforts that compress the vein. Deep vein thrombosis is more common in the legs, and when it occurs in the shoulders or arms, the cause is either recent surgery, a foreign object inserted into the upper body, such as a central line, pacemaker, or implantable cardioverter defibrillator, or thoracic outlet syndrome. Sometimes the venous and arterial syndromes are known together as vascular thoracic outlet syndrome. What is thoracic outlet syndrome, and how is it diagnosed, and how is it treated? Well, going by symptoms is one method of arterial thoracic outlet syndrome. And some of those symptoms that you would see with arterial thoracic outlet syndrome would be cold and pale hand, pain in the hand and arm, especially during overhead motions of the arm, an embolism or a blockage of an artery in the hand or arm, aneurysm of the subclavian artery can also be another symptom that you would have. Many patients ask me, well, what causes thoracic outlet syndrome? And, sometimes it can be congenital from birth. And that usually comes from an abnormality that can cause thoracic outlet syndrome. So it's more likely, though, to occur after an injury or bodybuilding, and a little less likely to occur from birth. But if it does occur from birth, To get more specific, you could have a cervical rib, an extra rib. Cervical rib is that extra rib that grows from the cervical spine, the base of the spine. And between about 1 and 3% of the population has a cervical rib. And it may grow on one side or both and may reach down to attach to the first rib or may not be fully formed. Having a cervical rib increases the chance of nerve or blood vessel compression between the rib or its muscles and ligamentous connections that share this small space, the thoracic outlet. A small percentage of people with a cervical rib develop thoracic outlet syndrome. Many people with a cervical rib never even know it because the bone is often tiny and isn't even noticed, even on x-rays. Abnormal muscle or first rib formation is another issue that people have. Some people may have that extra or aberrant scalene muscle, which is an inner muscle of the neck, or an abnormal first rib or clavicle or collarbone. Any of these abnormal formations can compress blood vessels or nerves. Now, the following events may cause thoracic outlet syndrome, especially in people with the above bone or muscle abnormalities I just spoke of in the neck. And one of those conditions is whiplash. Arm and hand symptoms that persist long after a whiplash injury may be a sign of thoracic outlet syndrome. Bodybuilding. Built up muscles in the neck may grow too large and compress nerves or even the subclavian vessels. Also, repeated overhead motions. People who take up swimming, baseball, or painting, or who work as hairstylists or auto mechanics or other jobs that require raised arms, that may develop into thoracic outlet syndrome. Another condition, weight gain. As with extra muscle mass, extra fat in the neck may compress nerves or subclavian vessels. And last would be a tumor in the neck. Those are rare occasions. A tumor may cause compression. Now, how is thoracic outlet syndrome diagnosed? We spoke about symptoms, but thoracic outlet syndrome is sometimes considered controversial as the symptoms can be vague and similar to other conditions. It's important to be evaluated by someone who can distinguish between the various types of thoracic outlet syndrome and rule out other conditions. An evaluation begins with most or all of the following: a complete medical history and review of your symptoms, physical maneuvers and orthopedic tests and movements to provoke your symptoms. We then evaluate by history to rule out nerve-related conditions such as carpal tunnel syndrome, cubital tunnel syndrome, cervical spine disease, or other types of nerve entrapment, which have similar symptoms and may be confused for thoracic outlet syndrome. Sometimes I have to perform tests such as a nerve conduction study, an x-ray, or prescribe an MRI of the cervical spine, which would be necessary to rule these out. And luckily, at Synergy Wellness in New York City, we have state-of-the-art equipment, including digital x-ray and a new Cadwell Sierra Summit nerve conduction machine. Other tests that can help aid with diagnosis, and they are frequently ordered. Some of those tests include a duplex ultrasound to check for stenosis or narrowing of a blood vessel or occlusion of a blood vessel. Another thing would be a chest x-ray to check for cervical rib or abnormal first rib. And if neurogenic thoracic outlet syndrome is suspected, besides doing an EMG or nerve test, brachial plexus block can be done, which is a local anesthetic injected into the scalene muscles of the neck. The chance of having neurogenic thoracic outlet syndrome is stronger if other symptoms disappear while this area is numb. Now, what you've all been waiting for, how is thoracic outlet syndrome treated? Well, treatment depends on the type of thoracic outlet syndrome, whether it's neurogenic or vascular, but some of them overlap. So let's get right into it. Treatment for the first type, neurogenic thoracic outlet syndrome, would be physical therapy, chiropractic care, and these are typically the first modes of treatment. And then something less known and newer, something we have at Synergy Wellness, cold laser or low-level laser therapy can be used for all types of thoracic outlet syndrome. And then you also have Botox injections. And those are sometimes effective when physical therapy, chiropractic, or cold laser therapy doesn't completely relieve your symptoms. If symptoms persist after physical therapy, chiropractic, laser, and injections, surgery may be recommended in this situation. Now, surgery can involve cutting small muscles of the neck, anterior and middle scalenes, and removing the cervical or first rib, if that's what your problem is. A lot of people ask me, can it reoccur? Well, sometimes neurogenic thoracic outlet syndrome recurs months or years after treatment, and this may happen because of scar tissue from the surgical site, or because the condition was misdiagnosed the first time, treated incorrectly the first time, or you re-injured it. The beauty of cold laser therapy is that it can be done prior to surgery to avoid it, and after surgery if needed to break up scar tissue. Nothing breaks up scar tissue to the level of cold laser. Nothing. Now, treatment for venous thoracic outlet syndrome. Well, we can use cold laser therapy. It's extremely safe and effective. It works by vasodilating the compressed veins and reducing the inflammation around the veins. Chiropractic adjustments to the cervical spine and the rib, clavicle, or first rib are effective treatments to alleviate venous, arterial, and neurogenic thoracic outlet syndrome. If a trial of about 15 laser sessions over the course of a few weeks doesn't yield any results, then unfortunately surgery is usually recommended for venous thoracic outlet syndrome. And this may involve removing both scalene and subclavius muscles and the first rib. The vein itself must also be treated. Blood clots often form around the damaged inner surface of the compressed vein. So some of those treatments include medication like blood thinners to treat clots. Or there's another procedure called thrombolysis. It's a procedure to remove a clot from the vein, usually done before thoracic outlet syndrome. Usually a vascular surgeon would do that. Now, there's also a post-rib resection venogram, and a procedure done 2 or 3 weeks after thoracic outlet surgery to check any remaining damage to the vein. The vein can usually be treated with balloon angioplasty, in which a balloon is used to expand the narrowed vein, and or a transaxillary first rib resection for thoracic outlet syndrome. Treatment for arterial thoracic outlet syndrome. First, a trial of cold laser therapy of 15 sessions over 4 weeks. It's a non-invasive, safe, and effective treatment. If it doesn't yield results, surgery is usually recommended for arterial thoracic outlet syndrome. This may involve removing both the scalene muscles in the neck and the cervical rib, if present, and the first rib. So you want to make sure that you try all non-invasive treatment techniques to avoid this surgery. Some other treatments for arterial thoracic outlet syndrome would be blood thinners as well to treat clots, or reconstruction or replacement of the artery if the artery has an aneurysm or contains a clot. Now, sometimes this has to be done bilaterally on both sides. It's occasional, doesn't happen often, but occasionally you will see thoracic outlet syndrome bilaterally. People who are diagnosed with thoracic outlet syndrome on one side may and should have the other side checked, but they should not be treated unless they show definite signs or symptoms on that other side. So, folks, I hope this was helpful for you. For those of you who might be struggling with this condition, I hope this helps you seek out the right help. If you have any questions or comments, don't hesitate to write them below. Don't forget to subscribe. Give me a couple thumbs ups. It's really what keeps this channel going. Thank you, everyone, and thanks for tuning in.